Welcome to West Michigan Air Care's Landing Zone Safety class. I'm Dawn Johnston, Flight Nurse and Marketing Coordinator for Air Care, and this online class will teach you how to safely set up and operate a landing zone, also called an LZ. You'll learn how to select, prepare, and manage an LZ, and how to communicate with ground and air crews effectively, all with safety at the forefront of operations. Air Care is based out of Kalamazoo and has been serving southwest Michigan and northern Indiana since 1993. Our helicopter is green and blue, the colors of our sponsoring hospitals. Air Care is a well-established partnership between Bronson Methodist Hospital and Borgess Medical Center. Both are trauma centers in Kalamazoo. Air Care's patients are transported to receiving facilities offering a wide range of specialty care, including but not limited to trauma surgery, neurosurgery, burn care, heart surgery and interventional heart catheterization, high-risk obstetrics, and pediatric trauma and critical care. Most of Air Care's flights are hospital-to-hospital transports, where we land at an approved helipad or a local airport. Many of our flights, however, are scenes where we pick up trauma, heart attack, and stroke victims from improvised sites scouted out by you. And that's what we're here to talk about, setting up an LZ for a scene flight, whether on a road, in a field, in a parking lot, on a racetrack, or in someone's front yard. The flexibility of bringing specialized care to a critical patient quickly, no matter where they are, is the advantage of helicopter EMS rescue. And to do it safely is why scene personnel should receive training every 2 years. So let's learn how to set up and manage an LZ safely. Throughout this process, you'll also gain a better understanding of Air Care's operations. When you call us, our standard crew will respond, which consists of a pilot and 2 experienced critical care nurses who are also paramedics. Your dispatch will let us know your scene's coordinates based on the address. When we're about 5 minutes from the scene, the medical crew will contact the LZ coordinator by radio. The LZ coordinator plays a very important role in helping us find the LZ and getting us safely on the ground. You must choose a safe site for us to land considering the 4 S's: size, surface, slope, and surroundings. Let's cover these 4 main factors of site selection in detail. Landing zone size. The LZ you select should be at least 100 feet by 100 feet. Our helicopter is 45 feet long and 40 feet wide, including rotor span, so the area we require to land should be roughly double our size. Consider the spread of tree branches near or overhead. We require 100 by 100 feet all the way to the ground. Additionally, the shape of the LZ can be square, rectangular, or circular, as long as the narrowest diameter or width is not less than 100 by 100 feet. Surface and slope. We want a surface that is firm, flat, and free of obstructions. In general, we prefer a paved road or a parking lot over a farm field, but the best LZ option is the one nearest the scene that meets all the requirements we're outlining here. Any aircraft will sink into a soft surface, so avoid setting up LZs in soft fields, especially after it rains or in the spring of the year. In dry weather, expect a lot of blowing dirt. Our aircraft generates dangerous high winds, so wear face, eye, and body protection and keep everyone far away from the LZ. If the LZ has a lot of loose dirt or gravel, it's a good idea to wet it down before the aircraft lands. In the winter, expect blowing snow, especially in fields and ungroomed areas. When landing at a snow-covered LZ, the pilot will come to a high hover and blow the snow away before landing. Regarding the slope of the LZ, we want the surface to be as flat or as level as possible. If the LZ does have a slope, please let us know before we land and tell us what direction it slopes. Slopes bring the rotor blades in closer contact with the ground and therefore nearer to personnel. Keep all personnel out of the LZ until the rotor blades have stopped. If the rotor blades are turning, do not attempt to help the aircrew with their equipment as they exit the aircraft. Keep yourself and everyone away and never approach the aircraft from the rear. Surroundings. Surroundings are very important to communicate in the LZ brief. Identify power lines, antennas, or any large hazard within 500 yards, and tell us about all wires and towers in the vicinity. For example, you can say, there are power lines to the south of the LZ and a 200-foot tower 1/2 mile to the east. Park vehicles under wires to help mark them. Secure all loose items near the LZ. Close and secure all vehicle doors. Make sure the LZ is set up a safe distance from the scene so dirt and debris aren't blown onto patients and rescuers. Do not mark the LZ with anything that can blow around and become a hazard to people on the ground or the aircraft. Orange cones are a good choice during daylight hours. These are easily visible during the day. Strobe lights are a better choice at night. Do not use flares or scene tape. We don't want flames near the aircraft, and caution tape can blow into the rotors. Remove all personnel from the LZ before the aircraft approaches. Place a marker in each corner of the LZ, plus one to mark the wind direction if able. Vehicles can use their lights at night to mark the LZ, but be prepared to shut them off at the pilot's request. As you plan your radio briefing, feel free to make some notes to stay organized. Remember that the names of cross streets, addresses, and mile markers are not useful for us like they are for you on the ground. We can't see street signs. Here's a sample of how to complete an LZ briefing over the radio.
AirCare, we're going to land you in a paved, level parking lot behind a school on the east side of Oakville. Now, the LZ is 100 by 100 feet and it's marked with cones. There's power lines to the east and a tree line to the north. We've parked apparatus under the wires to mark them, and there's a tower on the school and a large cell phone tower about a 1/2 mile to the north. The wind is out of the east at 12 miles per hour.
Here's another LZ briefing. This one describes a scene at night. Usually, AirCare can see emergency vehicle lights many miles away as we approach.
AirCare, we're landing you in a large, flat, grass-covered field just south of the accident scene, which is on County Road. There are a few wires running east-west along the north side of the road. There is a tree line west of the LZ. Now, the field is firm, and we've tested it by driving POVs and apparatus over it. The LZ is 100 by 100 feet, and it's marked with flashing strobes. Now, be advised, there is also a 300-foot tower about 1 mile south of this location. These are about the only known overhead obstructions we could find. The wind currently is 8 miles per hour out of the northeast.
Whenever you need a quick refresher on LZ specifications, go to our mobile website at aircare.org/mobile. Save the AC icon to your home screen for rapid use. This is a quick way to confirm you're covering all the requirements for a safe LZ. After dark, we use night vision goggles, or NVGs, to help us identify and locate hazards when approaching and departing LZs. NVGs are very sensitive to bright lights like floodlights, vehicle headlights, and some vehicle overhead lights. Be aware of this as our aircraft approaches, and avoid blinding the pilot with direct light beams from any source, including flashlights. Do not allow flash photography, as it can temporarily blind the pilot and damage the NVGs. When AirCare 1 calls you on the radio for an LZ brief, include a short summary of the 4 S's and any patient information that's available. Advise AirCare 1 when you have them in sight and help steer them to your location. For example, you can say, AirCare, I see you approaching and we're to your northwest. If you see a hazardous situation developing, tell AirCare 1 to abort, 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 or pull up, pull up, pull up. Do not assume the pilot and crew see the obvious. Once AirCare is landed, sometimes the medical crew will disembark before the rotors stop, but non-AirCare personnel cannot come near the aircraft ever when the blades are spinning. No one, including the LZ coordinator. And AirCare never loads the patient with the blades turning. We will always shut down for this. When AirCare lands, do not approach the aircraft until the blades come to a complete stop. Keeping the LZ secure throughout our entire time on the ground is very important. Never allow vehicles or pedestrians or anyone to enter the LZ without the pilot's permission. Keep everyone out of the LZ until we depart. Please be vigilant, as this has proven to be a recurrent problem and can lead to contact with the rotor blades immediately taking us out of service. Do not allow any vehicle, including law enforcement vehicles or ambulances, to pass through the LZ. Do not allow any personnel to approach the aircraft when the blades are spinning. Also, be aware that the blades are closest to the ground and most dangerous when they're slowing down or starting up. The rotor blades must be at a complete stop before any non-air care personnel can approach the aircraft. Our helicopter carries a number of hazardous materials on board. If you witness an accident, approach the aircraft with caution. Turning rotor blades are very hard to see. We carry about 200 gallons of Jet A fuel. There are 2 NiCad batteries in the nose and up to 8 liters of liquid oxygen in the tail. The best way to shut down the engines is to shoot water into the screened air inlets from the front of the aircraft below the rotor blades. Let's talk a little more about weather considerations. AirCare uses Visual Flight Rules, also called VFR, and we can also fly using Instrument Flight Rules, or IFR, which means flying blind, so to speak, using instruments. This is the key reason we can land near your scene at an airport, even if we can't land right at your scene due to poor visibility. As long as cloud ceilings are high enough, AirCare's IFR capability enables us to safely fly when VFR-only helicopter services cannot. When flying IFR, our pilot flies the aircraft in the clouds using instruments and local airport air traffic control. This can be done during cloudy days and nights with low visibility due to rain, snow, and haze. However, we will not operate in or near thunderstorms or when there is icing in the clouds in cold weather. These and other weather conditions like thick ground fog can compromise safe flying, so AirCare's pilots check multiple weather sources on changing weather days before accepting a flight. During IFR flights, our landings are limited to airports, so it's important to remember that we could meet your scene patient at a nearby airport if they're driven there in the ambulance, even when the weather is poor. Keep in mind, coordinating an unexpected IFR flight in changing weather can add several minutes to our arrival, so be ready to allow for logistics and timing adjustments if we're meeting your scene patient at an airport. These are necessary to fulfill our mission of safety. We're regulated by the Federal Aviation Administration under Part 135 of the Air Regulations. These are the standards applied to commercial air carriers rather than private pilots. In addition to the 4 main factors for site selection, here is a summary checklist our pilots want you to consider as AirCare is approaching your scene. This checklist can also be found on our mobile website at aircare.org/mobile. Mark the landing zone with orange cones by day and with flashing strobes at night. No flash photography. This may temporarily blind the pilot. You may use apparatus with overhead flashers to mark the LZ, but turn off headlights as the pilot approaches. Keep all vehicles out of the LZ at all times. Keep all personnel at least 100 feet from the helicopter during landings, takeoffs, and any time the blades are spinning. Wave the helicopter off or call over the radio, "Abort, abort, abort," if unsafe conditions develop, such as traffic in the LZ, a previously unnoticed obstruction, or other hazard. Keep all vehicle traffic at least 100 feet away from the helicopter. No smoking within 100 feet of the helicopter. Do not approach while rotors are turning. Never run towards the helicopter. Remember that high winds and loud noise are generated when we land and take off. Wear eye and hearing protection. Put your shields down. No loose articles such as hats, scarves, or open trash bins. Keep the doors to nearby ambulances closed to prevent entrance of debris during landing. Never approach the aircraft from the rear. Notify us and your dispatch if you are setting up an LZ over a quarter mile from the scene. Otherwise, it may be hard for us to find. West Michigan Air Care brings life-saving critical care from the hospital to the patient. We stabilize the patient, which buys the patient more time. We can accomplish most life-saving interventions the ER does in the first 15 minutes while in the field. Life-saving critical care at the scene may include rapid sequence intubation, chest tubes, surgical airways, and blood administration. The medical crew uses some of the latest technologies to provide definitive airway management, like optical and video laryngoscopes, plus ventilator strategies not used by ground EMS. So how do you know if your patient should be flown to a trauma center? The Fly Guides can help you make this decision, and these can be found on our mobile website. Just go to aircare.org/mobile and save the AC icon to your home screen. In addition to a quick LZ primer, you'll find a Fly Guide for every type of healthcare provider. We're going to focus on the First Responder Fly Guide. These were designed by Kevin Franklin, Flight Nurse and Utilization Review Coordinator for West Michigan Air Care, and are based on transport guidelines established by the CDC and the Michigan Trauma Coalition. These Fly Guides have been approved for use by the trauma directors at both Bronson Methodist Hospital and Borges Medical Center in Kalamazoo, so you can be confident in using the Fly Guides to determine which trauma patients should be flown directly to a trauma center without delay. Here is the Fly Guide for first responders. As you can see, the two large boxes help you decide when to launch Air Care or put us on standby and await the paramedics' decision. It's best to review the Fly Guides well so you're ready to make decisions quickly. Because first responders are often on scene well before EMS, our aim is to empower the first responder to launch Air Care for appropriate patients, thereby saving several minutes of the patient's lifetime. But if you're not sure, just put us on standby. That saves time too. We'll load up and be ready to fly when activated. At any multi-casualty scene, make sure Air Care and other helicopters take the most serious patients so they go directly to a trauma center. In many cases, Air Care can take a second patient, but we will not take 2 intubated patients. If you're not sure which patients are most serious, tell the medical crew so they can assist you in making the decision. Individual patient weight is limited to 400 pounds due to the width of our stretcher and the length of the securing straps. If the patient is too large to be safely secured in the helicopter, we'll usually stabilize the patient and take them by ground in the ambulance. If Air Care is busy with another flight, we will call for mutual aid from the nearest available flight service. If we can't fly due to weather between our base and your scene, we'll advise you if another service might be able to approach from another direction. We share turn-down information with surrounding services to assist them in making a safe decision on whether to fly. To summarize, the Landing Zone Coordinator plays the major role in keeping patients, air crews, ground crews, and bystanders safe. It begins with the 4 safe LZ selection factors and continues with the Landing Zone Safety Checklist. Identifying patients that would benefit most from our critical care capability can best be accomplished by becoming familiar with the Fly Guide for first responders. A quick refresher on all these points is located conveniently on Air Care's mobile website. Again, go to aircare.org/mobile and save the AC icon to your home screen. Landing zone education is recommended every 2 years. Your knowledge and situational awareness is what Air Care needs to keep doing what we do safely. We appreciate your assistance on scene. Feel free to contact us with any questions using our full website at aircare.org. You may also call us for more information or to transport a patient. From all of us at West Michigan Air Care, thanks for being a part of our team.